Well, joining us now live is Dr. Rimoin, professor of epidemiology and the chair in infectious diseases and public health at the UCLA Fielding School of Public Health. I mean, we heard some of those numbers now, some 500 confirmed cases, more than 130 people confirmed dead. What's your reaction to those updated numbers? What does that say to you about where this outbreak is at this point?
Well, this is a very concerning outbreak. The numbers are deeply, deeply worrisome. And we know that this is still just the tip of the iceberg. And I think that that's really what people are trying to explain here. It's not even just what's going to happen in terms of an acceleration of an outbreak, but how many cases are actually out there? What chains of transmission have we missed since this virus has had a month plus to get ahead of us?
And remind us again about this particular strain of Ebola and some of the challenges that it really does pose for, of course, the communities there, but also the health officials trying to battle this.
This is the Bundibugyo strain or species of Ebola virus. And there are multiple different strains of Ebola virus. This is one that causes symptomatic disease and certainly does result in reasonably high mortality. The issue with this particular species of Ebola virus is that most of the other all the vaccines, the therapeutics, and the diagnostics have really been geared towards another species, the Ebola virus species, which has been responsible for the vast majority of cases. So this is why it was so hard to diagnose this in the first place. The diagnostics that were out there were targeted at Ebola Zaire, and so missed the cases that cropped up at the beginning. And so that's why there have been so many chains of transmission that were undetected. And in terms of controlling it, we're going to have a much more difficult time without vaccines to prevent it and therapeutics to treat it.
Yeah, the WHO has declared this a public health emergency of international concern. How serious is that, and how much threat do you think this poses at this point to people in other countries?
Well, WHO calling it a public health emergency of international concern is a signal to the world that this is a real problem that's going to require international coordination and collaboration, and essentially a cry for all hands on deck. We have a problem we have to get in front of. And they were very right to call this public health emergency right away. Note that they did not wait to have an emergency committee organized. There was no time for consultation, and there was no need to do so because the situation was so serious once they understood it. So that should be a very big signal to the world why this was so important.
We have about a minute left here, but just in terms of the global response, I wanted to ask you about some of what we're seeing. The country of Jordan has banned travelers arriving from the DRC as well as Uganda over the Ebola outbreak. When it comes to these sorts of travel bans, do we know how effective they actually are?
Well, it really depends upon what the travel restrictions are. I do think that there needs to be really strong screening programs in place. That makes sense. But sometimes these bans are not really keeping people out. If it's somebody coming directly from another country, people reroute all the time. We know that sometimes travel bans are something that people use to say, hey, we're keeping our country safe, but it really, people are still going to find ways to move. So I think being very, very careful about screening, a lot of tracking, and a lot of testing is going to be the most important way forward.
Dr. Rimoin, professor of epidemiology there at UCLA, thank you as always.
Thanks, my pleasure to be here.